My name is Brittaney Jenkins. I'm the founder and CEO at Jenkins Public Health Consulting. I started public health before public health was even a career you should even think about pursuing. And it was really challenging for me because everyone in my network was like, don't choose to navigate or choose public health as a career because it's underpaid, all these things, all these misconceptions about the industry. And I still chose to pursue public health. A little bit more backstory is that I was working in a hospital. I noticed patients were there for preventable diseases, injuries, and deaths. It was just a lot for me. And I honestly kept getting in trouble because I was spending way more time with the patients, talking about their health and just being there for them because they're in the hospital. They're dealing with chronic illnesses and diseases and injuries and just huge lifestyle changes. And some people didn't make it out of there. From those experiences, working in clinics, hospitals, I said, I want to work in public health. I want to work to prevent this. What industry is this called where I can pursue a career where I help to educate people to prevent diseases, to prevent injuries, to prevent deaths, disability. And so those are the type of things that led me to pursue a career in public health. And now, over a decade later, working in healthcare and public health, I have not looked back. I am a certified health education specialist. I know that it is a valuable credential that anyone in the field of public health should obtain. And if you are a healthcare professional and you're looking to transition into public health careers, I highly recommend that. There are some qualifications that are required to sit for that certification. However, it is a great opportunity to understand more about public health programming, implementation, leadership, communication, sustainability efforts, and also negotiate your salary and offer letters when they come about. My background also includes that I manage grants, budgets, and programming throughout the course of my career. I'm originally from Indianapolis, Indiana, and moved to Birmingham, Alabama. We moved from Indiana to Nashville, Tennessee, to Birmingham, Alabama. We're chasing our goals. We're chasing our career goals and our dreams and stepping outside of the status quo, doing something different, taking risk and being adventurous. And it's been a lot of fun and it's been super challenging. And it's been a huge blessing on our lives. I met my husband in Indiana, where I'm originally from. He's originally from Georgia. And he was like, hey, within 6 months, I'm planning to leave here. And he didn't know that I was planning to leave Indiana at the same time, pretty much around 6 months. And so it was a no-brainer for me. Hey, this is my ticket out. Thankfully, there was a great opportunity that took him to Nashville, Tennessee. When we moved to Tennessee, that's where the breakthrough in my life and career actually changed. And though I did a lot of work in public health and healthcare in Indiana, that's when my salary went up tremendously by over 50%. As a health equity consultant, I actually support health organizations with their programs, partnerships, and building trust with communities to improve health outcomes. And with that, I do a lot of training and support and development with teams all over the United States. And it gives me a lot of insight on what the skills and challenges and plans organizations are working towards. I'm not coming in there for workforce development, even though it all goes together because I'm training their staff and supporting their staff. However, I've created the Public Health Mentor Program 5-6 years ago now to bring in those skills and insights from working with health organizations to help individuals who are trying to land mid to senior level jobs build skills, build confidence, know how to negotiate offer letters, know what these employers are looking for, how to stand out as the ideal candidate, using that insider information from me by working with these health organizations all over the United States and some internationally to help people stand out and go beyond the status quo, defying any misconceptions that are out there about what's possible and available to you as an individual.